If one would like to look into the future of what's happening in myeloma, I think the relapse setting is moving very fast. The landscape is going to change definitely. New players are coming into the scene. Recently, we've seen the approval of the selinexor, a new drug in penta-refractory patient. Hopefully in the next few weeks or months, we will get the antibody-drug conjugate, namely against BCMA, and the data are very promising. Of course, everybody is also talking about the CAR T cells. Of course, they're not approved yet, but they are used as part of clinical trials, compassionate use. So I think the major change that is going to happen in the next couple of years is within the relapse setting, and how are we going to incorporate these new players in the treatment algorithm. And when I say new players, it's not only about totally new drugs with a novel mechanism of action. Even when you look into alkylating agent, a drug like mefloquine is very promising. The mechanism of action is alkylation, but actually you have a totally different positive safety profile compared to melphalan. So it's moving in all directions, and of course this is always good news for the patient, for the physicians. Also, it will make our decision process more complicated, but this is, I would say, a good problem to have.